Hi, the goal for today's lesson is to talk about how antipsychotic medications work and how they are used to treat schizophrenia spectrum disorder. So just to make sure you're in the right place in your clinical psych notes packet, here we are. So you should have already done the note taking and the activity for diagnosing schizophrenia, and now we're talking about antipsychotic medications. So you at this point should know a little bit about the difference between positive and negative symptoms of schizophrenia spectrum disorder. Positive symptoms are symptoms that are actively inappropriate, meaning someone who does not have schizophrenia would not experience these symptoms, and those are hallucinations and delusions. The way that antipsychotic medications work is that they reduce the amount of dopamine in the synapse, or in some cases increase serotonin. But we're going to focus on what's called the dopamine hypothesis, which holds that an increase or an excess amount of dopamine at the synapse is correlated with positive symptoms of schizophrenia, what is known as psychosis, which are hallucinations and delusions. So again, these medications are combating only the positive symptoms, not the negative symptoms. Negative symptoms are symptoms that people without schizophrenia are able to do that those with schizophrenia cannot. So for example, the ability to express emotion, that might be impaired with someone with schizophrenia, and that is called flat affect. Let's look real quickly at the way that antipsychotic drugs work. So dopamine, normally we know, crosses the synapse between two neurons, and that activates the next cell or the receiving neuron. However, what antipsychotic drugs do is that they bind to the receptor sites on the next neuron's dendrite, and it blocks dopamine from being able to act. So it's decreasing the activity of dopamine by blocking dopamine's ability to act on the receptor cells of the next neuron's dendrite. So again, just make sure that you understand this dopamine hypothesis, that an excess of dopamine in the synapse is correlated with positive symptoms of schizophrenia, and that antipsychotic medications act to decrease the amount of dopamine available at the synapse. So side effects of antipsychotic medication include something called tardive dyskinesia, or involuntary facial movements. I want to go to a website real quickly that shows you exactly what tardive dyskinesia looks like. So I'm just going to play you a couple examples so you can see. Okay, so tardive dyskinesia is a possible side effect of many of these antipsychotic medications. Newer drugs like Risperdal and Zyprexa have fewer side effects, however, can in some cases increase chances of an individual developing diabetes. So these types of medications are used oftentimes not in isolation, but along with life skills programs and family support to really help improve the day-to-day functioning of people with schizophrenia.